Good afternoon, ladies and gentlemen, and welcome to VideoDRs.com. Today we're going to show you a new tool that was developed to work within the Practice Fusion SOAP note to create a quick and easy note for a physician. We know most doctors like Practice Fusion. It's very simple to use, but in the actual subjective, objective assessment and plan section of the note, there's an excessive amount of typing. So we're going to show you how you can build a note quickly, get paid for the right level of service provided. This one is for 99213, and also get you home at night so you're not spending many hours after work, after seeing 30 patients trying to create notes. So let's just take a quick look. This is a typical template that was created by myself with regard to review of systems. If I'm going in here and I want to make changes, I have to make physical changes in here and type in different answers in order to create the information for the ROS. We're going to show you how we can create a full note very quickly and easily using our Statim Note product. So with that, let's go to Statim Note. Statim Note is designed around the idea that the physician can create a note without templates. Templates are not necessary because the chief complaint becomes the template. At the end of the day, we all know that the objective assessment and plan components are all the same in these notes. It's just the chief complaints that are different. So instead of having a complaint for backache, a complaint for ear, whatever the situation is, we can just dictate the complaint and then also document that in the current note that we're in. All these notes are customizable and can be easily changed for any particular type of specialty. We also have voice-related dictation built in. Unlike Dragon, which costs between $900 and $1,500 a license, we provided a voice recognition system right into the note, which is proprietary to our Statim Note. Dragon's a great product. However, you have to train it. You have to read Lincoln's Gettysburg Address. You have to read the Kennedy or Norville Address. It needs to parse your emails. It has to look at letters you've written. It's trying to understand the cadence and the way you speak. Once that's accomplished, which may take many hours of training, then you still have to understand all the commands in the system, how to begin a paragraph, end a paragraph, things that doctors and mostly clinicians are not interested in spending all this time learning that type of product. That in mind, look at how simple it is to actually create a chief complaint using our dictation system. Patient complains of pain in the left ear, period. So we can quickly and easily put in chief complaints. As you all know as clinicians, when somebody comes in for an earache or sore throat, they basically always going to mention, oh, by the way, he's got these other issues. We can take multiple chief complaints on the fly. So let's do that. Also, I have a sore throat, period. I'm also having trouble with my lower back and my neck after sleeping for 4 or 5 hours at a time. So very quickly and easily grab those chief complaints. Patient history and past medical history, HBIs, are all in the existing SOAP note, so we're not going to concern ourselves with that. We're going to go into our review of systems, and we're going to go into our exam and our objective assessment and plan. So this note is broken out to basically fill those sections of the Practice Fusion note. So let's begin with the review of systems. So we're gonna go with a sore throat and earache and lower back pain. So fever and chills, night sweats. We're gonna go in and say that we have sore throat, runny nose, ear pain, sinus pressure, swollen glands. Come down a little further, and we can show you how we can customize the note. Patient has non-productive dry cough, period. We come down a little further, and we're going to go into musculoskeletal. So we're going to say we have back pain. Patient has pain in the lower back, maybe a lumbar sprain, comma, but is also complaining about C5, C6 area in his neck. So we picked up all that information very clearly and nicely. Moving down into the exam. With the exam, we code by exception. So when we click, everything becomes normal. So we're going to say that he is well appearing, okay, and we're going to go down and touch off on the oral cavity. We're going to say there's a postnasal drip. In the tonsil area, we're going to say Patient has enlarged tonsils that have pus pockets on the outside of the tonsils. We move down into the objective part. So I'm going to just do some quick dictation in here to show you how this works. This would be the objective information obtained from the exam, and this is going to be transferred into Practice Fusion, period. The assessment is normally where the diagnosis would go, and we're going to show that the medical terminology is being picked up. Patient has otitis media, comma, acute pharyngitis, comma, and lower back lumbar sprain. We're going to add some more. Patient may have damage to C5, C6 in his neck. Recommend that he sees neurologist, period. Patient should be put on 250 milligram Z-Pak for 7 days. Return after 7 days to see if the infection has been abated, period. Patient should go to a neurologist with regard to neck and back pain, period. So now we'll move into saving the note. We're going to basically transfer this note now to Practice Fusion. I'm going to copy it, open up Practice Fusion, come in, we'll show you that there's nothing in the chief complaint, it's empty, and we're going to post this information. So we're posting the chief complaint, we're recording the subjective, we're recording the objective, the assessment, and the plan. Now the system tells us that the note is complete. We say OK. So we can go up and parse this note and see the information in here. It's been placed in. We can go back in here and actually print the note. So what I'm going to do is make this a little bigger so you can see it. And it shows in here general chills, night sweats. Patient denies, but he has runny nose, dizziness, ear pain, blurred vision, swollen glands. When we come down a little further, we look for respiratory, cough. Patient denies. The patient has non-productive dry cough. So we're picking up all the dictation. In the general, ill appearing, everything shows normal until we get to the throat cavity, postnasal drip. Patient has enlarged tonsils, pus pockets on the outside of the tonsils. Here's the objective information that was dictated, the assessment, and the plan. So you can see it's very, very easy and simple to build a note in Practice Fusion and move that data over, which is very, very nice and exciting. Also, we also have independent dictation that we can add into the system. So let me go into the chief complaint and say, let's edit that. And now what I want to do is just add some additional information. So this is to show you how we can add additional information directly into the chief complaint, even after it was sent over from the note system. So that's how that works. Picked it right up. But what's also interesting is, let's shrink this down a little bit so we can see it a little better. Let's go into a diagnosis. Say we want to record a diagnosis. We'll open that up and turn on our dictation. Congestive heart failure. Pretty handy tool for somebody who can't spell particular types of, say, diagnoses, medical technicians or lay people that want to work within the system. They can just dictate and it picks it up, and it allows them to actually choose something and actually create a note. So it's actually very nice with regard to that. So the system allows for you to build a very high quality note, get paid for the services that you are rendering, but also get you out of the office on a decent hour so you're not spending hours after work putting information into the EHR.